Making palliative care part of the routine cancer treatment not only saves healthcare dollars, but leaves patients with slightly longer and happier lives. That's according to Dr. Thomas Smith, Director of Palliative Medicine for Johns Hopkins Medical Institutions. We caught up with him at the 8th Annual Chicago Supportive Oncology meeting.
Well, the best way to keep costs under control is actually to provide the best care. And that's one of the amazing pieces of information we've learned about integrating palliative care into usual oncology care. Not only is there less depression, less anxiety, less caregiver distress, people may live at least as long, if not longer, but the cost is lower. And it becomes lower because we ask people, what's important to you? What are you hoping for? If you're going to die, is it okay that we get hospice involved? And do you want to be at home? Ask those questions and people will say, you know, I want to be snuggling with my cats and dogs and maybe my husband when I'm at home. I really don't want to be in the hospital. And study after study has found that the care is better and it actually reduces costs. How many other things in medicine do that? Obstacles to better integration of palliative care typically, unfortunately, reside with the oncologist. The other one is the family. Some families and patients simply don't believe that they could ever die from their illness. That was a study in the New England Journal of Medicine yesterday that 69% of colorectal cancer patients and 81% of lung cancer patients felt like a person like them could actually be cured by chemotherapy. And we don't know whether that's the oncologist didn't tell them, or we didn't tell them often enough, or we didn't tell them in an effective enough way and often enough, or they just simply chose not to believe us, or they had a completely different belief system that didn't include medicines at all. It's probably some combination, plus the indomitable human spirit. So those patients who want the best care can actually get the best care when you have palliative care involved with their regular oncologist.
Dr. Anthony Bach, oncologist and professor of medicine at the University of Washington, added that treatment success is more likely if oncologists include the cost conversation in the decision-making process.
Cost is something that patients face every day and are often embarrassed to bring into the room. So it's really important for you to validate that's important and make it part of the decision-making process, not a separate standalone. Because the thing the patient struggles with the most is, how do I incorporate this into the treatment choice I'm faced with? And if you don't figure that out, you'll make this great recommendation, have this great discussion, and the patient will leave and they'll come back and nothing's happened, and you go, hey, what happened? And they'll say, I couldn't afford it. And so you've wasted your time. They feel terrible because now they feel like the treatment they need is out of reach. It's a lose-lose. So it's really important for those cost things to be part of the discussion and for us as clinicians to bring them in. And it's going to take our initiative.